I think it would be to stay curious. I think curiosity helps us connect with ourselves, stay grounded. I think it helps us connect with our patients, find humility, and be able to empathize with what they're going through. And I think it also helps us identify where we need to make changes in our practice and improve.
I would say always trust your instincts. If you feel like something's wrong, you're usually right. You know your patient, and you know what's going on with them, and if you feel like something is wrong, it probably is. Tell the doctor and advocate for your patient.
I think the advice that I tend to always give others as they start their journey, especially my nursing students, is that, nursing is so varied. You can really go anywhere with your nursing degree. You might think now that you want to be a critical care nurse or you want to go into pediatrics, and you might get out there that first year and you go, oh, this is really not for me. And that's the really great thing about nursing is you can go, okay, let's find a different specialty area. Let's go somewhere else. Or I can go back and get an advanced degree and do something completely different.
The first piece of advice is always to be an active listener. It's important to listen and make sure that you're supportive, and that's with the people that you work with so that you can collaborate well, and then with your residents or patients as well. The second piece of advice would be to never give up. Keep working through every obstacle and challenge that you have, and always ask questions.
I would say stay rooted in compassion, but don't neglect competency. Master your skills, communicate clearly, and keep learning. And just remember that integrity counts more than any degree or title.
So the most important thing is, I think, especially when you're new, you need to ask for assistance, be open to others to, helping you. Because in nursing, teamwork and collaboration are huge, right? We're not working in silos. So I think that was an important advice that somebody gave me that I would impart to somebody else. I think we get burned out if we do everything by ourselves, right? We take on everything. But if you distribute the workload a little bit, it helps. It helps alleviate some of that.
I think to start your nursing journey, you really need to try and investigate different avenues to get into the profession. If you can, work at the hospital at some level to see what it's like, to see if it's for you. Even if you can get in working in a doctor's office, a clinic, just doing something related to the healthcare field, you may find a different path. It might not be nursing, but it might be something in healthcare, or you might just fall in love with nursing. But I think the best way is to actually get yourself in somewhere to actually see what healthcare is all about.
So the advice that I would give to nurse leaders just starting out is to really take time and listen. We spend a lot of time listening to our patients and their families, and we're good at that, but we're not always good at listening to each other. We sometimes don't hear the things from people that don't have all the education and experience. We need to really focus on listening to our peers as well as to those we work with, not within the profession of nursing.
So I'm very fortunate in that I teach full-time. So I get students before they become nurses, and I tell them that the most important thing is compassion and empathy. And that not everybody's perfect. Sometimes you have to step out of the room and take a deep breath. But for that 5 minutes, put yourself in that person's place, and it will make things easier. But most importantly, take care of yourself or you can't do it at all.